going to ask something very mundane, actually, and also something nobody actually give a lot of thought about it, is your poop. Everybody poops. I think that's something is common here between all of us. But have you ever given it a thought that what your poop can tell us about your health? Probably not, because doctors, scientists, even mothers, with young child, they are so obsessed about their child, the infant's poop, the color, the texture, and everything. Well, poop is actually a window to our health. It really reflects, the health of our gut, because it contains so many germs, those microbiome and everything. But once you flush it out, it becomes part of a very large sewage network, right? The sewage network, which traverses through your city, just underneath your feet right now, hundreds and thousands kilometers of pipes, taking your poop, everybody's poop, sewage, to somewhere called sewage treatment plants. So from your gut to city's gut, right? These treatment plants are actually designed to clean this sewage water to make it reusable for the city. Now, that's a great thing to do, right? And having a sewage network is actually a sign of a very developed society, that you are part of a very developed city. And a lot of time when you do not have a very good sewage network, that actually is implicated or linked to having high disease transmission, diarrheal diseases, cholera, you just name it. But also, it's also responsible for one of the drivers where you have a lower social or economic development. Now, that's a very powerful thing, right? Just not having a good sewage network or sanitation network can really pull you down. I bet you all are thinking what kind of sewage network we have in Bengaluru, right? We do actually. Bengaluru is a very, very densely populated city. Nearly 14 million people are here. And we have a 28 functional treatment plants. I'm saying it functional because I'm aware of those functional treatment plants, which are scattered around all over the city. And they process on daily basis this sewage for all of us. Something like around 1,147, million liters of water per day. You know what that roughly equates to? Something like 100 liters per person per day. Now that's a lot of water, right? Now, what you should be asking that what happens to this water when it gets treated by these treatment plants? Where does it go? And does it actually ever get used in the city for different reasons? Well, actually it does. To make this water clean, to make it not just clean from pollutants and from chemicals, from pathogens, when it is good enough for reuse, some of it gets released in the city to the lakes and other purposes. But a lot of it actually gets released outside the city. And that's where Bengaluru has a very high water footprint, as I would call it, because there are a lot of drought-prone areas outside the city which are dependent on this water year-round to grow the crops and also for the groundwater recharging. Apparently, Bangalore is the second largest city after Mexico where you have this kind of city. So what you just learned, that you have this treated water, sewage water, something you never thought about, where farmers are using it for the food, for growing, gives it water security, and for the city dweller, food security. What kind of circular economy, right? Where you are forming in this water scarce world. And that's a really fantastic thing, right? Which people are doing. But actually, what you haven't never thought that does this sewage hold some of the answers for your health as well? What kind of pathogens it's carrying? Just one sample from this sewage, if you analyze, it's a gold mine of pathogens. You can detect tons of bacteria, viruses, which can give you health data for millions and thousands of people in a community. So you're not going and testing individual person to ask for those diseases. You have this data just in one sample and you can analyze. And that's true for COVID and for other diseases as well. Now you must be thinking, so how does it work? Well, the moment you get infected with a virus or any pathogen, let's say virus, say COVID, right? You won't even get a symptom, but your body starts excreting the virus days before you develop symptom or even you get tested. During COVID time, what we realized, what we understood, that COVID data from the sewage was a lead indicator of upcoming cases. We could tell at least 7 to 15 days in advance just by looking at the viral load. Because this viral load, we are not just detecting, looking at the presence or absence of the COVID. We are also able to quantify it. And this quantification part is the real holy grail. You can tell whether the trend is increasing or decreasing. Now, having a warning, say 7 to 14 days, you might think that's not a lot of time for anyone to know. So how does it matter? It does. Because 14 days in pandemic or 7 days in pandemic is a lot of time for healthcare professionals to understand where should I be putting my resources? Should I up my healthcare system? Should I be having those oxygen cylinders? Should I be having more vaccinations for vulnerable populations? Should I be having masking for individuals? Or as an individual, if you know about there's a high viral load, should you be holding a festival or a wedding party or something now as opposed to somewhere later? Right? So that's how powerful this information becomes. And this is what it was realized during the COVID time around the globe in the world, that if sewage has the answers for some of these diseases, let's do it for the SARS-CoV-2. So within a span of months, there are more than 70 countries who are lurking what's lurking around this sewage for the COVID. That's how it started. But also for our country as well, there are several cities who are involved in this. Like Hyderabad has a sewage surveillance system. So is Pune. There is one in Gujarat. Because there was so much uncertainty during the pandemic that how many people are infected, how is the virus transmitting through the city, and how many people, are carrying what variant. And all of that can be answered through just from the sewage surveillance data. I am going to show you just a small story from Bangalore, how this evolved and where we are and how it helps our healthcare system. So back in August 2021, this is just after the Delta wave. I don't want to remind anyone what a havoc it caused, both mentally and personally in so many different ways. And it was such a toll on our healthcare system that people were running pillar to post to understand what direction this pandemic is going to take. In those days, in August 2021, in a multi-stakeholder partnership, we initiated this sewage surveillance for Bengaluru. So we went out and we started sampling the sewage treatment plants on a weekly basis. Now, the idea was to understand how the virus is going, but the sewage surveillance is just not about detecting the virus, as I'm saying. There were several challenges to setting up a surveillance program of this scale, right? Something meaningful. And I tell you what that meaningfulness means. The real challenge of sewage surveillance is it should be done in real time, which means the day you collect the sample, the sewage sample from this treatment plant, it must be analyzed on the same day. It's a pandemic data, remember? So you need to know what kind of infection you are seeing, whether you're detecting the virus and what viral load are you up against. Which also meant that we should have a very efficient team. So within a span of weeks, we had to assemble a team which can be trained and be useful for this purposes. But also, unlike other developing world where people are using automated sampler and, we had to do it all manually. So we are collecting samples. So 28 treatment plants, weekly basis, you do the math. We are pretty much somebody is out there every day collecting the sample and bringing it to the lab. We do it every day, even today, as if now I speak here. Now you got the sample. You have to come up with protocols which are cost effective, because if the technology and everything works, so you can use it in other low resource settings. But also economical but also less time consuming. We were up against time, right? We have to get things going. We done that. As a researchers, as scientists, we could detect the virus and everything is hunky-dory, fine, great. But then as a scientist, sewage surveillance is not about just us. You need to have very intricate knowledge of the sewage network. How do you use this data? The data is meaningfully when you can tell which parts or pockets of the city are experiencing high or low viral load. So you can strategize your actions, right? So we went ahead and we joined hands with some urban planners, but also people who understand the sanitation network. So we had several collaborators on board, Biome and Monitors. They really helped us, and it was a perfect match. And what you're seeing right now behind me is the map of Bengaluru, which shows that The darker the color goes, that's the higher the real-time dynamics of the viral load. And it tells you which catchment area of which treatment plant, which sewage treatment plants are having viral load. Now you have, you can detect the virus, you also understand the sewage network. What do you do with this data? The data needs to be used so that it can be used for public healthcare action. So we started having several sets of workshops, meetings with the municipal corporation just to make them understand it's a very complex data. People need to understand what's the limitations and what's the strength of this data. We had so many meetings to understand to interpret this data and how this data can be used on the ground. And until today, this data has been shared with them on a regular basis. I'm going to walk you through the time series trend for this viral load for the last 2 years, just to understand how to interpret this data. It's very simple. So on the right side of me, actually on my left side here, is the COVID data, which you get from the clinical testing based on the RT-PCRs. Everybody knows RT-PCR now. And on the right side is the data you get from the sewage data from the viral load. What's interesting thing about this data is that in 2022, there are 2 peaks which you can see in both the data sets, and it matches perfectly. And the reason for that is that a lot of people were getting tested at that time. So there is though the data sets tracks very well. However, in the last year and a half, there's a divergence in the 2 data sets. And the reason being that not enough people are getting tested now, because people are very well vaccinated. There are rapid antigen tests are also around, so there is not so much of reporting. But again, what you understand from it that you can choose not to get tested, but what you can't choose not to go to the toilet, right? Because if you are infected, you will be shedding the virus, you will be excreting the virus, which shows up in the sewage. And what we saw last year in April, we had a wave which was much larger than the Omicron wave. Even until a month before, also we had a wave which was seen. So when you see a wave going through the city, the first question which is asked by anybody, is it something new which is happening in terms of the COVID, some new variant which has come up? Or is it some people behavior which is driving these rise in infections in the city? People behavior could be you are gathering New Year parties, some festival is coming, people are not masking enough, or something very transmissible, some virulent strain which has entered in the community. So I'll give you an example how this data tells us what variant is going on and how this actually affects the public health decision, which impacts our life in going forward. So what you see that in June 2022, we saw a rise in the COVID cases, but also the same thing appeared in the viral data. And this was seen not just in Bengaluru, but also in Mumbai and other cities. So one question was asked that if you're seeing a surge, what variant? We do a lot of genomic sequencing as well. And one thing about this work is that when you do the sequencing, you see a larger number of variants than actually you ever record in clinical data. Remember, this is a community data. You're not testing an individual. And what we found, there were so many lineages were lurking around and is a kind of a variant soup going through the city, which was driving gas, some new, some old. But it was just after the time when people got back to work, schools were open. So that kind of carryover effect has taken place. We went ahead and we reported the data as usual to the public health system, and they issued a new mask mandate for the city that there should be improved vaccination, but also mask mandate, but also the guidelines not to have big gatherings. You can ask me one question now that you are telling us about sewage treatment plants. What about the cities where we do not have sewage treatment plants? How will it work there? Because a lot of cities in India do not have a sanitation network, right? Well, actually, it can be done in open drains as well, even if you don't have a well laid out sanitation network. And this is exactly how sewage surveillance started back in 2001 for polio eradication program. So this is not a new public health tool. It has been around for years. And one of the reasons India got rid of polio because they used this sewage surveillance along with the vaccination program. And how it worked was you have in Mumbai, in a very densely populated area where they see a surge in the cases, they had these network of sites which were tested for presence of polio virus. You can detect one infected person among, say, 14,000 inhabitants. That's how powerful it is. And once you know where the viral load is coming, you can do hot spotting, you can increase your vaccination, And you can also understand, vaccination is also working going forward. Until today, it is part of our public healthcare system. This is how we work through polio when we say we are polio free. Okay. So what you just understood, right? You have this sewage surveillance, which is cost effective, which is also gives you a non-invasive way of data for the large population, but also it can be implemented anywhere. So why it is not mainstream? What can we do? As a bunch of academics, researchers with the government, we are providing this data. We are working towards chasing the pandemic in real time. What we need to make these such programs into the main healthcare system so it can be applied to detect other pathogens you don't know, pathogens you know. So imagine now you have these kind of partnerships which happen, say in other cities also, which work together and they formulate a system like this. But also imagine while you're following these sewage, you can detect, say, different pathogens which are driving, say, different respiratory viruses, say H1N1, H3N2, different kind of infections happening in the city. But also to figure out for some diseases what will be driving those infections. Is it because of the climate change? Is it because of the land use, land cover, urbanization? All these things affect our city life, right? You can make a panel of diseases which can make our city much healthier for us. So what I am trying to say that sewage surveillance is a great sentinel. It's a real kind of a gold mine of pathogen. And clean or reuse water connects not just us, but both urban life, but also the rural life in a very good way. And now it's to us, whether we use it or leave it, basically. But I leave it you with one thought here. Next time when you use toilet, just think how you are connected to this circle of life and how you are contributing to this health information. Thank you.